welcome to PharmaShots ViVE pre-conference interview series. We are pleased to feature Dr. Aasim Saeed, founder and CEO of Amenities Health today. So he is a physician turned healthcare innovator where he is reimagining how care extends beyond clinical walls by addressing the non-medical factors and that can influence the patient outcome. Hi, Dr. Saeed, how are you doing today?
I'm doing great. Thank you for having me.
Can you tell about yourself and then we'll jump to Amenities Health and then we'll talk about the company.
Sure thing. So a little bit of my background. My name is Aasim Saeed. I'm here in Dallas, Texas. My background very quickly is I studied medicine and public policy in grad school as a joint degree. But I always say I didn't do a clinical residency, but my residency was during my couple of years following graduation with McKinsey and Company as a consultant in the healthcare industry. I worked with almost exclusively large US healthcare systems and really focused on the business of medicine, a lot of growth, strategy, innovation type work with those large healthcare systems for several years. And then eventually I went, went native and joined one of those former clients, Baylor Scott and White Health here in Dallas, Texas. And Baylor is the largest nonprofit healthcare system in the state of Texas. It's about a $15 billion health system. And I led innovation there for 4 years prior to launching Amenities in 21. My time at Baylor was really unique in the sense that Baylor is, I think, officially the most profitable nonprofit healthcare system in the country now. And a big part of that were a lot of the consumer initiatives that my team led, specifically the MyBSW Health application, which has disproportionately attracted commercial patients to Baylor Scott and White and really directly contributes to its really extravagant profitability, almost at 12% margin. And just for reference, everyone in DFW does pretty well because of the payer mix in the city. But at the same time, HCA, a for-profit healthcare system in the same region, is about 8% margins. And so that's the type of world where I've specialized my career, is how to make healthcare systems profitable and, in fact, financially viable in some cases when they're not doing so well. And we'll talk a little bit more about that with Amenities.
Perfect. So, how you founded it, how the company started, give us a little brief about the history, and then I'll jump on to the whole market which you are targeted to.
Sure. So a couple of the principles that led me to launch Amenities was, one, as I mentioned earlier, we got really good at acquiring new patients at Baylor. A lot of that was just making things easier for patients, ability to download an app, register, add their family members, book an appointment in 2 minutes. But one thing that I thought that not just Baylor, but the entire healthcare ecosystem does incredibly poorly is patient loyalty. There's no standard definition for patient loyalty in this industry, but if there was one, it would be in-network utilization. So large healthcare systems that literally can serve patients from cradle till grave, yet good in-network utilization for patients who say they love these systems is like 30 to 40%. And that is absurd to me because the patient lifetime value for a US healthcare patient in this country is $500,000 to $1 million plus. That is unsustainable. Somebody will come and figure out how to delight these patients if we don't do that for ourselves. And so I left to launch Amenities, and the name implies to create this delight factor, this stickiness factor, to create a loyalty program in healthcare that has otherwise really kind of lacked that for the last 2 decades. And so we'll talk a little bit more, but Amenities was really founded on how do we get large healthcare systems to make massive bets on patient experience as differentiators for both their patient retention and loyalty, but more importantly, for their financial success. And that's what we're going to talk about today.
So, as most of people know, the concierge care or advanced diagnostic, these are not a new market or like not a new thing. But then it is gaining a lot of traction because of the elderly population or people who are not able to give the proper care to to their friends and families. So how do you see the segment is evolving, and what are the opportunity does it create for the healthcare system?
I think unfortunately, healthcare systems and most of the ecosystem have really struggled with adoption of technologies like largely because that is a technology that is looking for a business case. And that is a backwards way to look at everything in healthcare. And that's pretty standard what we do all the time. We're like, hey, even we're doing it right now with AI. We're like, AI, what can we AI? And nobody is starting with what are the major problems and how do we address those using the latest technologies. And so we kind of reset first. And I'll come back to your question about remote technologies because I do think they are a big piece of this puzzle. But what we try to point health systems out, which is an undeniable problem that sometimes it feels like nobody is focused on, is the lack of profitability. So specifically 2026, the One Big Beautiful Bill Act that was signed by Congress last summer is set to take out $32 billion from large US healthcare systems because of cuts directly to Medicaid and Medicare reimbursements. And what that means is every individual healthcare system we talk to, on average this year, due to no fault of their own, is going to be facing $20 to $50 million less budget. And if they don't do something about that, that's going to lead to some real belt tightening, some real cuts, including the C-suite of these healthcare systems. And so the problem is you need more money and you don't know how to get it. And so what we try to point out to people is commercial patients have always subsidized Medicaid in this country. Now, Medicaid reimbursement comes lower. It is frankly malpractice to not start realizing that on the other end of the spectrum, there is a $29 billion market of cash pay, 10% high growth CAGR market that is what we call the premium healthcare market that healthcare systems are almost completely absent from. Now, this includes concierge, executive medicine, longevity, but also things like advanced diagnostics and remote wearable data and remote patient monitoring. And that's why. So before we get into like how do we adopt this, we need to know what we're solving for, which is you need to generate new revenues, and there is massive market signal that patients are interested in this and you are not participating in this market at all. And so amenities is really a bridge to say that is the reason you're not participating is you don't know how. Healthcare systems do a lot of amazing work for the communities they reside in and for this entire country, but they are not good at delighting patients and adopting new technologies in a clear business model that they can launch quickly and profitably. That's where we come in. So we are a turnkey solution to help healthcare systems enter this market, leveraging their number one asset, which is their brand.
Right. So, can you please talk about more about how this model help in the revenue diversification?
Absolutely. So as I mentioned earlier, so I used to be the head of innovation at a healthcare system. And so I was the buyer for all these technologies that would come to market. And one of the things that drove me crazy was all of the vendors had the same story, which was, hey, our technology is amazing. You should pay us to buy it. You take it, though, and deploy all the risk of actually operationalizing it. And then also, could you give us a great review and talk to our investors about how amazing we are? That is complete and utter bullshit. Like healthcare systems know that they are bad. They're not blind to the idea that they're bad at going and capturing value and deploying technologies. We need vendors who will come to us. I'm saying now the royal us, now I'm on the other side here, but that vendors need to be coming to the table with not just the technology, but the entire both business model and operational risk on them. And health systems should be sharing in the upside. And so we specifically help, quote, diversify revenue, as you asked, because we revenue share. Unlike 99% of other solutions in the market, we immediately generate revenue from the first day of launch because, again, we are taking all of the operational risk. Our providers, our technology, our go-to-market, we leverage the healthcare systems brand, their physical network of facilities in case our patients need to go there, and then also their clinical oversight, and we revenue share the premium membership that the patient pays with the healthcare system. So we are a business in a box with, again, minimal capital investment, no FTEs, but massive upside. When I say massive upside, I mean to the opportunity in most markets of up to $20 million in pure profit in the first 5 years. that can be delivered directly from us to our health system partners in these innovative business models.
So I was thinking about the partnership model, but then you have already answered that question. So let's talk about wearable AI-driven diagnostic solution. So how these emerging technologies is helping the premium care model
Sure. I
for the
think
patients. Yeah.
so. Premium care again touches a lot of things. There's advanced diagnostics like function health. There's body scan, DEXA body scans. There's a number of advanced kind of functional testing like VO2 max, grip strength in the longevity space. There's all these things happening, but the interesting thing is there's already kind of AI adjacent bots that come with all these solutions, right? Like everybody has same access to the same thing, let alone every individual patient can just take their results and throw it into ChatGPT or whatever their personal AI choice is. We believe that the thing missing in the market and specifically the opportunity for large healthcare systems is that AI is helpful in breaking down the missing piece of all of the ubiquity of AI right now is a human to help walk you through it, especially a trusted human, which in this case is the doctor. And so in our memberships, I think we are taking advantage of the fact that patients are already spending their hard-earned dollars, their time and effort getting these advanced diagnostics, but don't really have a trusted partner to help review information. And so in addition to our concierge premium memberships in both primary care as well as longevity and kind of premium services, we are going to be adding eventually remote diagnostics, wearable data, all of these kind of advanced testings. But the key to our value proposition and therefore the healthcare systems is that it is a trusted doctor from a trusted brand that will walk you through that information and help
Yeah.
build a proactive, personalized prevention plan and wellness. So those are the opportunities where I think the world of amazing things that are happening with advanced testing as well as AI and all the data being generated connect to the core competency of a healthcare system and how they can connect that value proposition clearly for patients.
Awesome. So I think we are toward the ends of this quick pre-conference series. Do you also put some light on what are the trends or innovation in concierge care do you think have biggest impact?
Yeah, I think there's a couple of things I would point out. So one is I think the concierge care is no longer taboo. I think there was a broader sentiment 5 years ago, maybe even 1 year ago, where, well, what about equity? What about how it's going to look if we offer concierge? Look, right, wrong, or indifferent, this is America, and people are willing to pay for better experiences. And if you just stay on the sidelines, you're just again not taking appropriate financial advantage of the opportunities that your brand should afford you if you're a large healthcare system. I think most healthcare systems are past that. Most everybody in the market is past that. And the question is, how good are you at competing in concierge? So that is, I think, a big shift in this last year. And then I think the second thing is going to be who's going to make sense out of the 50 different things that patients can buy, right? Because whether it's a gut biome, whether it's a full body CT, whether it's a 100 labs that tell you something, whether it's your Aura ring that is monitoring you constantly, we are in no shortage of information. We are in no shortage of cheap information that we can go buy and piecemeal. The question is for consumers, for every one of us who's indulged in buying all of these things, is what do I do about it? Who's going to help me both build a simple, actionable, and accountable plan? And who better than a trusted physician if we can make the pricing work to do that? And that's what we're here to do. And again, those are the things that are, I think, for the healthy people that are taking these proactive steps. But at some point, those people are going to need traditional care services. And that's where health systems really need to get in off the sideline and be a partner in this space, be available for all the proactive people, and don't just be sick care anymore. We all know every health system has some platitude that they put out about how we want to be a proactive, a real health partner, not a sick care partner. Well, now's the time to do something about it.
Perfect. That was a really deep answer for a very Shallow question, I would say. All right, it was nice talking to you, and I hope I'll meet you at ViVE conference at LA this year. And this is one of our interview for in the pre-conference series here. And thank you for having and thank you for giving us your time here.
Yeah, well, it was a pleasure spending time with you. If anybody's interested, especially health systems, large medical groups, large practices that are thinking about how do we enter the space of the premium healthcare market, please reach out. Visit our website at amenitieshealth.com, just like the word amenities, like a pool at the hotel. Or reach out to me directly at Aasim, AASIM, at amenitieshealth.com. And hopefully get a chance to say hello in person, Aditya. Great to meet you.